This morning, we're taking some time to focus on heart health, especially for women. And here with an update on what's happening at the Heart and Vascular Care Center at Overlake Medical Center is Dr. Heidi Neiswarner. Welcome to New Day.
Thank you so much.
Amazing. So tell us about the mission of the Heart and Vascular Care program over at Overlake.
Thank you. So at Overlake Heart and Vascular, we really have the premier care on the east side. We have aspects of care ranging from prevention, early detection, treatment, and of course chronic disease management. We do everything.
Oh, and one-stop shop, which
Yes.
we always like. What are some of the unique risk factors for women that are experiencing heart attack symptoms?
Yeah, so women in general, it's always important to know that they have most likely chest pain or pressure when they have heart attack symptoms, but women also have unique symptoms that sometimes can be written off or ignored. Things like fatigue, shortness of breath, and nausea, which are not the most common symptoms people think about, and like I said, can sometimes go ignored.
And when is a good time to call your doctor or come in? Because like you said, some of those symptoms don't seem like you would want to maybe cause a huge stir about, like
Sure.
if you're feeling just fatigued.
Sure. So understanding your risk is really important to help decide if you need extra care. I think understanding things like your own blood pressure, your cholesterol, your family history, things that would put you at higher risk for heart disease, and then symptoms that just don't feel right to you. So something that is not normal for you and something that you've never really talked to a doctor about, you certainly want to get evaluated.
Okay, great. And what is the connection between pregnancy and heart health?
So pregnancy is a really unique time for women because risk factors that can arise during pregnancy, complications of pregnancy like preeclampsia, gestational diabetes, can actually turn into risk factors for heart disease later on. So women who've developed diseases like preeclampsia are at much higher risk for cardiovascular disease, about 3 times as likely, and they're also at risk for hypertension, about 5 times as likely, and that's much higher than most women who don't have these conditions.
Gosh, and what are some prevention strategies that anyone can take and should be thinking about?
So I think the ones that we always talk about are things like eating healthy and doing routine exercise, but you also don't want to forget things like stress management. We can all do better with that. and getting enough sleep. Those are some other things to really think about too.
Yeah, and when you say get enough sleep, I feel like that's thrown around a lot, but what exactly does that mean? How many hours and eating healthy, if you could just expand on that?
Yeah, so from a diet standpoint, we have a lot of data that using a Mediterranean style diet is really important for heart health, especially if you have risk factors. And then sleep is variable for each person. Even over the course of your lifetime, you might find that you have different needs. In women, menopause is a time when your sleep needs can change, but really trying to kind of work on what is best for yourself. An average of around 8 hours, of course, is ideal.
Definitely. And tell me more about the mission and why, the Heart and Vascular Care program should be a place that people should definitely consider.
We really strive to aim for individualized care, so looking at each person and trying to identify how we can help that person and not just treating them like one of a group. I think all of the docs at our practice really focus on that and want to provide the best, most cutting edge care.
Definitely. So how can people learn more about the program and beyond?
So I would recommend just checking out our website for Overlake Heart and Vascular, and you'll be able to find any of us there.
Amazing. Thank you so much for your time, doctor. We appreciate it.
Thank you so much.
And to learn more about what we discussed today with Overlake's Heart and Vascular Care program, just visit the website that you see right there on your screen.
New Day Northwest is sponsored by Overlake Medical Center and Clinics.